Hi, my name is Dr. Youngsoo Victoria Sum. Welcome to Victoria Plastic Surgery Center. As a physician, I hear often, "Doctor, I woke up one day and my face has fallen. I look 10 years older." We all know how that feels. I wake up and say, "What happened to my face? Why is it all droopy?" So let's think about what we can do to improve that. There's a lot of talk about facelifts. Well, what is a facelift? I think it's actually a misnomer. When we have aging face, we have to look at the face proportionally. And once again, let's go back to the basics. So if you take your face and divide it into thirds, we have the upper third, the middle third, and the lower third. So what we really are concerned with, what happens when the upper third ages, or the gravity, who's not our friend, works its way into our face. Then you have the brow position that's a little bit lower. You have the eyelid skin that droops down. Then when you go down to the middle third, you have your cheeks that instead of staying up and rejuvenated, it actually loses volume and it falls. Then you have the lower third where the jaws and the chin line droop and you get what's called jowls, and next thing you know, it's involving your neck. So when we talk about facelift, traditionally, we're talking about doing something to the middle or the lower third. We use the term neck lift, or same thing as lower facelift, the mid facelift, or full facelift. What a neck lift is, if you don't have much jowl, but you have some bands on your neck and you have wrinkly skin, then you're doing surgery to resolve that and to make it look fresher. But when you have jowls, you're really looking at a full facelift. A full facelift really means that you're making an incision in front of your eyes, hugging your ear contour so that you don't have that traditional line that's in the front of your face that a lot of people think about when they see a facelift, and hugs your earlobe and goes behind your ear. But a lot of women get a little scared when they say full facelift. Am I old enough? Do I need to really do this? What I usually tell people is that think about holding up a frame. When you have a 5-pound frame, then all you need is a simple hook and a nail. However, if you have 200 or 300-pound frame, then you need 3-point fixation, and that's what we need to look at your face. So we need to look at your age, what your lifestyle is once again, and what the proportions are from the top of your face down to your neck and going into your chest wall. And if it's just the neck, all you need is the simple neck lift. If it's just a little bit of jowls, all you need is a lower facelift. But it's involving your mid face and your upper face, then yes, we need that 3-point fixation that we would need when we're hanging a heavy frame. So that's how we think about when we're doing the facelift. A lot of people say, well, I don't want to go and tell my friends that I had facelift. So when patients are really concerned with a misnomer, I just tell people, you're going to have a lower facelift or a neck lift. We'll just make the incision a little bit higher to give that extra oomph or the extra fixation point. And a lot of people are very happy with that. So don't think facelift is all that complicated. When you divide your face into proportions, then you'll know where you fall. And also, people say, what's a good time for facelift? Well, we used to think that facelift was really for older people. But let's look at our longevity. We're living into the 90s. So even if you're in your 40s and 50s, think about the fact that you're going to live another 40 plus years. So when we think about facelift in modern terms, we think about quality of life. You could be in your 40s and you have that little jowl that's not proportioned to the rest of your face. Well, we can do a simple lift of the jowls for you. If you are a little bit older and you feel like it's really involving the lower face and the neck, then we can go and address those issues. But then if you feel that you are age inappropriate when compared to your friends, we can go for the full facelift. So when we're really talking about facelift, it's not because your face has fallen to the ground where my face has melted. It's really more about how we feel. Do we feel that we have really aged appropriately in our minds or when compared with our friends? And that's when you need to speak with your board certified plastic surgeon to determine if you're the right candidate for facelift. Sometimes I tell people, you're not a candidate for surgery. Let's think about something else. Maybe we can rejuvenate you with injectables. Maybe we can rejuvenate you with just simple skincare or with laser treatment. Or maybe you really do need that surgery. That's why it's important to consult with a board certified plastic surgeon so you and your physician can determine what would be the best rejuvenation for your face. We welcome you at Victoria Plastic Surgery Center.